Welcome back to the channel. What does a Donald Trump administration mean for healthcare? What can it mean? What are some opportunities here? That's what I'm going to be talking about in this video. By now, it's clear Donald Trump has won in a landslide victory. He has won states that people thought he couldn't win. Side note, you may recall on the VPZD show, I was saying that polling is grossly inaccurate. It's not even a science. It's run by nitwits who don't even know what they're doing. They're just picking and choosing what to weigh. And in fact, that's true as I said. It's exactly true. The polling is such an impractical and imperfect science. They shouldn't even be doing it. And I think Donald Trump's intuition on the Joe Rogan podcast is correct, that he doesn't put much stock in it, and he doesn't know what they're doing with all that money, and I think that's been borne out to be true. He's been reelected, and he's talking about putting somebody like Robert F. Kennedy Jr. in charge of public health and regulatory affairs and healthcare, and people are very concerned about that. But here I'm going to talk about what can be done constructively that I think actually everybody will agree on. Everybody will agree on, except if you work at one of these companies. Maybe Albert Bourla won't agree on it, but everyone who's sensible will agree. And that's the topic of my recent Substack post. What a Trump presidency can mean for healthcare. 9 suggestions. I think now I'm going to make it 10 in this video to make America healthy again. I do like that healthy again idea, although perhaps in the past it was never that healthy because even when we weren't overweight, we were dying of other diseases and causes like smoking and infectious disease. But the idea of making America healthy, I think that's a very important idea. So, here are some ideas. Number 1, conflict of interest. Here's something that Robert F. Kennedy Jr. is correct about that I think most doctors, medical centers, universities, elites are not correct about, which is that financial conflict of interest has got to go. The University of Chicago Medical School has just announced that the new cancer center is going to be called the AbbVie Cancer Center. That's because the University of Chicago is such a prostitute for pharma money that for $75 million, they'll sell the name on the building. For a little more, they might even sell the name University of Chicago and call them the Pfizer School of Medicine, whatever pharma company gives them the most money. That is absolutely horrific and outrageous that we allow universities to prostitute themselves to companies and take all this money from companies, universities essentially becoming the clinical trials arm of companies, the CRO of companies. And then, of course, the university does nothing to stop companies when they have unethical trials, bad medical products. They have faculty members taking pharma payments, and they promote all this nonsense. Robert F. Kennedy Jr. doesn't want any of that. He wants to put a halt on all these conflicts of interest. And I think he's right, and they're all wrong. All the elites are wrong on this issue. He's the only one right. And so I think there's a great opportunity to finally end conflict of interest. The FDA commissioner, like Scott Gottlieb, shouldn't then be a board member for Pfizer. That's disgusting. He shouldn't be able to censor Alex Berenson on Twitter to promote Pfizer products and promote an unethical mandate. Clearly conflicted. So RFK Jr. has tremendous opportunity to end conflict of interest. Conflict of interest has got to go. That's just such a great thing. How would I do it? I would have a revolving door politics rule on federal agencies. So it's like FDA, you can't go to work for companies for some cooling off period. I'd make the cooling off period so long that it would probably strongly discourage that. I would actually probably increase the salaries at FDA so that it's not so bad a job to work there and it's more honorable and you can have a career there. But I would prevent the revolving door politics. And the other thing I would do is I would change the Sunshine Act, which was a disclosure act, to actually have some real prohibitions. If you take, more than $100 or $50 from pharma, or more than $1,000 from pharma, you can pick a number. It'll be arbitrary, of course, but we can pick a number. Then you can't be on the guidelines committees. You can't be writing guidelines that mandate Medicaid and Medicare pay for commercial products. So I would crush that conflict of interest. It needs to go. It's abject corruption. Number 2, the CDC is a complete and total failure. The people in Atlanta who are in the CDC, 40,000 people, mostly working by Zoom, they decided that 2-year-olds have to wear cloth masks. They pull that recommendation from their ass. They're complete idiots because only an idiot would tell a 2-year-old to wear cloth mask. The policy actually that they recommended was to wear it when you're in daycare, except for when you all nap in the same room for 2 hours, breathing the same air. That just speaks to how incompetent they are. I think you can easily go to a CDC and fire 10,000 people, no question. And anyone involved in that policy who recommended it or didn't put a halt on it needs to be fired for simply lacking common sense. If you were running a company, you would fire someone who's grossly incompetent. Those people should be fired. People who didn't stop that policy should also be fired for not stopping something clearly harmful. There are actual parents who are thrown off airplanes because their 2-year-old, some of whom may even have autism, didn't wear a cloth mask. They're asked to step off the airplane. The fact that the U.S. allowed that is so horrific. All those people need to go. The CDC also needs to be broken into 2 organizations. One, tiny one, in charge of statistics, keeping track of how many kids died of COVID. You may recall that they actually could not do that properly. They had many inaccuracies. We've documented in the paper statistical and numerical errors of the CDC. On the other side, there should be a policy advisory arm. These should be completely separate because if you're advising policy and keeping the statistics, you can juke the stats to fit your policy, which is exactly what it appears to me that they did. Number 3, the National Institutes of Health is a complete failure. Francis Collins had a long term. When he wasn't demonizing people like the Great Barrington Declaration, he was presiding over a broken and fragmented grant system. In all the years he worked at NIH, he never once ran a randomized trial testing the current grant-giving system against something like a modified lottery. He was completely incompetent. You need an NIH director who's willing to say, we're going to take a grant giving and subject it to prospective randomized control trials to figure out what works best. You need somebody like a Jay Bhattacharya or John Ioannidis to go to the NIH and completely reform it. The NIH needs a haircut, probably also needs to lose a lot of people. I think even having an intramural branch needs to be reconsidered. It needs to be trimmed down drastically. An intramural non-competitive branch is merely a government welfare program for scientists who don't want to compete in universities. That's what I think. So that's got to go. People are not going to like that, but it's got to go. Number 4, the FDA is a complete and total failure. It rubber stamps useless products. It needs to either remove itself from the picture and have a laissez-faire market, which would actually lower prices with more competition, or it needs to demand clinical trials that measure the correct endpoints. Things like clinical endpoints, not things like the protein level after you institute taking a product. The FDA is a complete and total failure. Peter Marks is a failure. Gene therapy is a failure. So many of their approvals, aducanumab a failure. Exondys is a failure. They need complete and total gut rehab. Will RFK Jr. do all the things they need to do? Time will tell. One of the things he should do this is the great compromise. I call it the great compromise for vaccine products. He's concerned about a lot of safety signals, and a lot of scientists are adamant that those safety signals don't exist. Okay, here's the compromise. Create a large phase 4 safety registry, active surveillance for all pharmaceutical products, including vaccines, and have safety be accurately documented. Also, for prospective products, have long-term randomized control trial where some fraction of people don't get crossed over, so you have a true placebo control, and follow them vigorously for side effects. You have to suggest to him what is the method that we all agree will adjudicate this issue. We can't argue about the side effects. We can't argue about the passage. We have to all agree on what the surveillance system should be. That's the constructive solution, and I think he can do it. CMS, number 5. CMS has to stop paying for drugs that don't work. They can't pay for these useless failed products. We can't have bills going through Congress to have them pay for multi-cancer genomic testing when those frankly shitty companies have never run a randomized control trial showing a reduction in all cancer mortality. CMS has to pay for things that actually work, and if not, don't tax poor people to pay for bullshit. That's got to get better. Number 6, children nutrition. RFK Jr. suggested that schools feed children nutritious lunches, and people criticized him. Well, he's right. The lunch they serve kids is dog food. They need to serve them something nutritious and healthy. We can learn from places like France and Japan on what it means to feed kids something good. I think Casey and Kelly Means would be great to be brought in on that conversation, and many other people. Processed food. Yeah, America does have a problem with processed food, and it does have a problem with obesity, and Ozempic is probably not the magic bullet. And rather than continue to eat garbage and have to inject yourself with a product that prevents you from wanting to eat, we might reconsider the subsidies that take place in the food ecosystem. Number 8, repeal vaccine indemnification. Now, this means that pharmaceutical firms that make vaccine products are not allowed to be litigated about those products. That's wrong. They should be able to be litigated. Now, I've been in some group chats, and doctors say that medical malpractice is screwed up and people litigate doctors unnecessarily, and that will happen here. I 100% concede that medical malpractice is screwed up. I 100% concede that people litigate doctors for no good reason, and medical malpractice is a fucking disaster that also needs reform. But here, the analogy to vaccine indemnification is pills. Do people litigate pharmaceutical pills wrongly? Very little. Actually, most of the litigation on pharmaceutical pills like Vioxx, etc., has been good litigation. extending that litigation to vaccines is not going to be really that different. I think vaccines should be subject to the same litigation. Also, this idea not to indemnify them, that came from a world where they weren't making a lot of money. Now they're making $100 billion off our backs, or rather our arms. They need to be subject to litigation risk. And of course, they need to all get sued for myocarditis, and all the universities that implemented that mandate and booster mandate should be litigated for myocarditis. And then maybe then the AbbVie School of Medicine can kick out some money to the people who are harmed with their broken and faulty policy. And maybe then these people who work as middle managers should not be implementing medical product mandates when they don't have any idea what they're doing. They should be discouraged from that. Number 9, I have a whole bullet point in my thing called Fire Peter Marks at FDA. Oh, I think he should be fired. I think he's a renegade. I think he clearly showed partisanship when he said that he would not approve a vaccine that he felt was not safe or effective under Trump, and then they changed the statistical analysis plan in the Pfizer vaccine study, not looking at 32 events, but altering that, and FDA approved that change. That to me is extremely problematic. As such, I think he has to go. Partisans have no role in FDA, and also his approvals are just plain bad. I think that would all be good suggestion. I had a 10th one. What was the 10th one I had? It'll come to me. But in the meantime, I want to say a couple other things. There is a doctor. I have to read you what she said. I just think it just speaks so poorly of doctors. Maybe I'll put it on the screen here. How many minutes am I into this? Okay, 11-minute mark. You know, it's really hard after the fact to remember where to put my screenshot in. Okay, this is a doctor. I don't know, this is a professor of medicine, I think in the Los Angeles area. This doctor writes, I've been on and off crying since 2 a.m. My belief that the majority of people are inherently good has been shattered. No explanation will suffice. I see she's an ICU physician. I just want to say I'm uncomfortable when a doctor would say that 70+ million Americans are not good people. You can disagree with how someone votes, but to really impute on them that they're a good or bad person, I think is extremely problematic, especially problematic if you're a physician whose job is to take care of everyone, to be going around and labeling somebody as a bad person merely because they didn't vote for the candidate you liked. I certainly don't think anyone's a bad person for how they voted, whether you agree or disagree with how they voted. I think this is really kind of dangerous rhetoric. And then I'll say there's one more example that popped up in my feed yesterday. What was this example that troubled me? This was an interesting example. Let me find it right here on my phone. Here it is. Michigan, Wisconsin, Pennsylvania. I'll put it up on the screen. Michigan, Wisconsin, Pennsylvania. Michigan, Wisconsin, Pennsylvania manifesting. And this is a person that sort of has continuously tweeted support for Harris. And then this morning, this person locks their profile. I think that's bad. I mean, to be so explicitly partisan that you are constantly reminding your audience, particularly if you practice in a swing state. I noticed that, this is it. Pharmaceutical companies should not be advertising on television. That's number 10. Of course they shouldn't be advertising on television. Only 2 broken nations, the UK, the US, and the New Zealand do that, and New Zealand has other checks and balances. So that was number 10. I don't think doctors should be overtly political. I don't think they should be telling you who to vote for, and I don't think they should even be using your time in clinic to telling you to vote. I think they should shut up and focus on medicine, which they are neglecting. Like, patients already feel cheated with how much time they have to talk about their health. We don't need the doctor to be cajoling you to vote, and I certainly don't think they need to be, on social media telling you that you're a bad person depending on who you vote for. And then, God forbid, you end up in the ICU with this person as your doctor. I mean, would you even feel comfortable? I mean, I think that it's a mess. Last part, nature. Nature today has a completely silly story. Let me read it to you here. What did it say? It said something that was particularly bad. Oh, yes. Nature, quote, I've witnessed something that I feel is extremely bad, not just for the United States, but for the rest of the world. And it says, we need to be ready for a new world. Scientists globally react to Trump election win. And then they mostly interview scientists who are unhappy about it because Nature doesn't know any scientists who are happy about it. I mean, this is the how medical journals become more and more partisan. They lose their credibility. They need to be neutral. Nature, New England Journal, they shouldn't be endorsing candidates. They should be focusing on science. For science to have credibility, they should be focusing on science. They don't seem to do that. So, a problem. Well, those are my thoughts, So what can a Trump presidency mean for healthcare? I think that, crying about it is not helpful. offering concrete solutions that everyone can agree on. And that's what I'm going to be doing on my Substack. In a couple more days, I'm going to have more and more concrete solutions everyone can agree on, except for maybe Albert Bourla at Pfizer. Any sensible person will agree you shouldn't be FDA commissioner than the board of directors for Pfizer, that we do need a better phase 4 surveillance system. People who think the current phase 4 surveillance system is adequate, if they think it's adequate, ask them, what is the bound safety signal? For instance, let's just say MI. What odds ratio MI would the current system be unable to detect? 1.05, 1.1, 1.15, 1.25, 1.5. And if they don't even understand what that question is asking, that the current system can only exclude safety signals with a certain magnitude, below which they can't, but below which could still be clinically relevant. If they don't understand the concept of that, they shouldn't even be talking about safety signals. I suspect most doctors don't even understand that concept, that all safety programs, nothing can say something is 100% safe. They can exclude safety signals above a certain magnitude, but below that magnitude, there are still important safety signals. And to find those safety signals, you need better surveillance systems. That's the point. So get RFK Jr. to make that surveillance system. He will likely agree if we all agree that this can detect like small safety signals, and then we will see what really shakes out. And I do suspect the COVID-19 vaccine will be linked to things that we hitherto have not linked it to. I'm happy to put a list of those. Maybe I'll put a list of what I think it will be linked to that it hasn't yet been linked to on my Substack, merely because there's some provisional evidence to suggest that's the case from some data sets. Okay, but of course myocarditis is a huge link. All right, that's the video. What can a Trump presidency mean for healthcare? I think it can mean significant opportunities for reform. And of course, I think there are pitfalls along the way. Like any sort of elected government, they can make mistakes along the way. The Biden administration, I think, made catastrophic errors, vaccine mandates and school closure, and he ran on a campaign of school closure, and he kept schools closed longer, masking kids, continue to mask kids, masking is a religion, hashtag I am the science, hashtag, what was that thing? Follow the science and all that bullshit. Yeah, there's no such thing as follow the science. It's about trade-offs, about enumerating those trade-offs, about letting people voice their concerns. I think they did a bad job, and I hope that we can do a better job going forward. So I'll be back later this week with Z-Dog on the VPZD show. We're going to have, I think, a really good conversation on Friday. I look forward to it. I bet we'll have some laughs. And you can check out the VPZD show. Subscribe at drvinayprasad.com to my Substack. That's where you keep up with me. Sensible Medicine is also going to be running some good stuff here. And I'm going to have more and more concrete suggestions in the days to come. So until next time.